This is Dr. Christopher Maloney talking to you about ADHD. Now, some people have ADD, attention deficit disorder. ADHD is attention deficit hyperactive disorder. So if you just zone out, if your child just zones out, that's attention deficit disorder. When they zone out and then run around the classroom, it's attention deficit hyperactive disorder. Now what's most interesting about this, and if you go to my website, you're on my website, you'll see that there's an overlap with autism. Before we kind of really had a sense of the autism spectrum, there were certain kids that were always diagnosed as autism. Before we had an idea of the spectrum, we didn't really understand that there is an overlap between these illnesses. On a brain scan, it is very difficult to differentiate what's the difference between the malfunctions. What's happening with attention deficit hyperactive disorder is that you're seeing both it's an inability to process sensory stimuli appropriately. And if you kind of classify all these illnesses in that framework, what you realize is that things that increase inflammation, so food, environmental factors, stress in the family, all of these different areas of problem all need to be addressed with all of these kids, because it's not going to be the same set of circumstances for each one of them. And so but you will consistently see kind of a pattern of sensory disorder. It's not that it's very easy for us to say, oh, the kid is having a problem, let's solve the problem. Here, kid, take what is basically the equivalent of amphetamines for the rest of your life. Now, no one really says to the parents, hey, by the way, adult attention deficit hyperactive disorder is a continuing disease. You're going to be on. Your child is basically signing up for a lifetime of these medications. And we do know that after 10, 15 years on these medications, you do see some major brain changes, as you would with any major drug that's all mind-altering. It doesn't mean that it's totally terrible, but it means that a lot of the child's whole life is being affected by that model. And if you can at all minimize the need for the medication by decreasing the level of stress or helping them cope in other ways with the stresses and the various environmental factors, it's much better for everyone in the long term. This is Dr. Christopher Maloney talking.